Hello and welcome to my YouTube channel. Today I'll be speaking to you about malaria. Why is it so dangerous? Many years ago, I saw this writing saying mosquitoes kill mosquitoes. How apt. Mosquitoes kill mosquitoes. And so what happens when you're bitten by the insect called mosquito? And so we're going to go through that in a moment. Now, firstly, it's that word malaria comes from an Italian word malaria, which means bad air. And so the thinking that there was earlier association of a disease with marshy areas. Maybe some idea about mosquito or malaria is not transmitted by air. It occurs when you are bitten by mosquito. So what happens? Now, firstly, just to mention to us that there are different parasites that can infect man, from Plasmodium falciparum, 𝐕𝐈𝐃𝐄, 𝐓𝐇𝐈𝐒, malaria, 𝐼𝐻𝐿. So there are different types. So the one that's really quite dangerous or cause potential harm is the falciparum species. So what happens when somebody is bitten by the female Anopheles mosquito? The mosquito comes to take blood from you, but whilst doing that, it injects sporozoids from its salivary gland into your blood. These sporozoids go through your blood and then to the liver. When they're in the liver, they form into a form called merozoids. So whereas some become merozoids, others go into a sleeping state called hypnozoids. I'll say something about that subsequently. The merozoids go into the blood circulation and get into the red blood cells. Whilst in the red blood cells, these merozoids form trophozoids and schizons. Okay? Trophozoids and schizons. Whilst doing that, it can rupture or get the red blood cell to burst, what we call hemolysis. So just imagine if you have such a large number of merozoids causing red blood cells in your body to rupture or to burst. What that means is that you become anemic. In other words, your blood level drops and you become tired easily. And so you see the relationship between having malaria and becoming fatigued, easily tired, because the malaria parasite will destroy red blood cells. So remember, it comes in as sporozoids, gets to the liver. Some of the sporozoids become merozoids, some remain as hypnozoids. The ones that remain as hypnozoids, after a number of months down the line, can wake up from that sleeping state and cause malaria. And so the species that particularly could be responsible for that would be 𝐕𝐈𝐃 and 𝐓𝐇𝐈𝐒. This is the reason why after you have traveled from the country where malaria is endemic, after some months, you could actually develop malaria, not because you were bitten by a mosquito in a new country, but because you had hypnozoids in your liver. I hope that is clear. Again, malaria is so dangerous because it could also affect organs. And if it does affect the brain, it could result in what's referred to as cerebral malaria. What are the symptoms of malaria? From fever to shivering to dry cough, fatigue, pain in joints, headache, nausea, vomiting, convulsions, and an enlarged spleen. Of course, anemia is really key because that will explain the symptoms of being extremely tired. You're fatigued, you find it difficult to get up from bed because the malaria parasites have hemolyzed or destroyed some of your red cells. Remember, the red cells are crucial in carrying oxygen from one part of the body to the other. So if you have reduced levels of red blood cells, it definitely will impact on your energy level. Again, malaria, the severe malaria, can actually cause jaundice, where you have yellow discoloration of the white part of the eye. It can cause kidney failure. It can cause severe anemia, like I've mentioned. And then there's a species of malaria, the Plasmodium, that can affect the kidneys, called the Plasmodium malaria, and can cause nephrotic syndrome. That's a different topic, but it's one of the problems that are associated with malaria. So in case you're wondering, so can malaria actually affect the kidneys? The answer is yes. Who are those that are particularly vulnerable? Who are those that are at risk? Pregnant women. And that's the reason why you see when a pregnant woman goes for antenatal, you could hear the doctor discussing about prophylaxis, in other words, medications that can prevent the mother from having malaria. Children that are between 6 months and 5 years, the reason being that between birth and 6 months, they're still utilizing, the immunity from the mom, okay? But between 6 months and 5 years, they've not developed, their own immunity is still immature, it's not fully developed, so they're at risk. And then visitors from non-endemic regions. So if you're coming from areas or countries where you've never had malaria, and you're visiting a country where malaria is endemic, or you could get bitten by the female Anopheles mosquito, please speak to your doctor about prophylaxis before traveling to those countries. And those who have been away from endemic areas, so you were born in an endemic area, in an endemic area, you had malaria when you were a child, growing up, and then you traveled out of this area into a country where there's no malaria. After so many years, you want to visit the country where you were born, you are at risk. And so you need to speak to your doctor for prophylaxis. How do we diagnose malaria? Usually from the symptoms. We really don't need too many things to diagnose malaria. If you've been bitten by a mosquito, you have fever, you have shivering, you have nausea, you have vomiting, you have pain in your joints, you've got anemia, it's almost certain that this is malaria. But of course, I need to mention that malaria is not the only cause of fever. So the history is crucial. Examination findings for some patients may have an enlarged spleen, what we call splenomegaly, and that could be a presentation in malaria. But we could do tests called the thin and thick blood film, where the doctor or the laboratory scientist looks under the microscope and could see whether a patient has got malaria or not. But of course, I need to mention that sometimes you could have the blood test done and they don't see any malaria parasite or trophozoites. Now, that does not mean 100% that you don't have malaria. And that's why sometimes, even when the laboratory result is showing no malaria parasite, the doctor may still, based on clinical judgment, go ahead to treat malaria. Okay. However, I need to also mention that if you've had repeated tests done for malaria parasites and it shows 3 consecutive days of tests for malaria parasite and it's negative, it's almost certain that we can rule out malaria and then focus on other causes of malaria. How do we treat malaria? Many years ago, we used to, there was a medication called chloroquine, which was quite effective. But of course, because of resistance, it's not that it can't work, but it may not work because of issues of resistance. And so we now talk about ACT, which is artemisinin based combination therapy, as ACT. And so you bring this and then combine them to deal with the malaria parasite. So you could combine artemether and lumefantrine, artesunate and mefloquine. So you bring these 2 medications to address the situation. And then the good old quinine. It's a medication that could still be used, but please, these medications I'm mentioning should not be used without consulting a doctor. You need to speak with a doctor to give you guidance and not to be your own doctor. Now, recall that I mentioned that when the sporozoites get into the liver, some of them remain in a sleeping state or in a sleeping state called hypnozoites. The problem is that when you take this malaria treatment, it could clear the ones that are in circulation, but the ones that are in the sleeping state may not be cleared. And that's why down the line, you may develop malaria again without being bitten by mosquitoes. And so for that type of treatment, may require what is referred to as radical cure. And so for that, medication called primaquine could be used. How do we then prevent malaria? Number 1, prophylaxis. In other words, if I take this medication, I can prevent the onset of malaria symptoms. So you address it before it starts. And so medications like Progranil or Paludrin with atovacone could be used. Mefloquine, doxycycline could be used, but please speak to your doctor before using these medications. How else can we prevent malaria? From preventing being bitten by mosquitoes. Of course, remember, if you don't get bitten, you shouldn't get malaria. If you don't get bitten, you shouldn't get malaria, except at some point you were bitten and then you had hypnozoites and then down the line you develop malaria again. So use full body clothing. In other words, the better you're clad, the more covered you are, the less likely you're going to be bitten by mosquitoes. But of course, some can be so dangerous in terms of mosquitoes that if the clothing is not thick enough, maybe, perhaps, you could be bitten through the clothing, perhaps. Also, the use of insecticide or insecticide-treated mosquito nets when you're sleeping, or insecticide sprays for the rooms. And then avoid stagnant water near you because of the eggs of these mosquitoes. So if you can prevent stagnant water near you, I mean, you go to some areas where they have tires of vehicles that are not being used. If you have water collection in those tires, they become an area where these eggs could be laid, and then down the line you could be victims of mosquito bites. So avoid small shallow collection of water or stagnant water near you, and then sometimes you could also get a mosquito repellents. Now if you use these measures, there's a good chance that you will not be bitten by mosquitoes and so will not have malaria. So clearly we've talked about malaria is dangerous, but remember this phrase: mosquitoes kill mosquitoes. Thank you.